Hey, it's me, Sizzle. This is probably my seventh time trying to do this. I'm vlogging because it is Gynecological Awareness Month this month, and I've been affected by cervical cancer in the last few months, and I really feel like it's important to talk about getting a pap smear. I'm here to talk about your vagina. If you are not getting a regular pap smear, please stop watching this. Hang up. Call your doctor, find a doctor, call Planned Parenthood if you don't have insurance or you need help, and get an appointment. It is the number one way to prevent cervical cancer is early detection. Over 11,000 women will be diagnosed with cervical cancer in the United States just this year. 3,800 women will die because of cervical cancer. That number has drastically decreased because of education around HPV and the link to cervical cancer and the increase in pap smears for women. So, get a pap smear. I'm going to keep saying it. Have you had your pap smear? You should have one a year. If you have HPV and you keep having abnormal paps, like me, you should probably have them twice a year. Now that I've had cervical cancer and I have some precancerous cells still hanging out in my cervix, I don't know why they want to keep partying in there, but it's obviously the place to be. I have to go see my gynecological oncologist every 3 months. So I'm very grateful to have insurance, even though I have had to pay a lot of money, and I'm going to keep paying money because apparently it's like $2,000 deductible or something. But if I didn't have insurance, I'm pretty sure Mr. Darcy and I would have no savings left. Some people that don't have insurance would go bankrupt, or they would have to choose between paying their mortgage and paying for their hospital bill. They would have to choose to get treatment or not get treatment if they didn't have any money. This is one of the many reasons that Obama is my president and continues to get my vote, because I think that Obamacare is one of the best plans that we have. We need better health care. We need everyone to have access to health care, because if you have to choose to not go because you can't pay for it, then people are going to keep dying. And that's fucked up, because we could stop it. So, again, have you had your PAP? Please go and call your doctor and make an appointment. If you have HPV, you should be going all the time. I'm pretty sure I already said that, but if you don't know you have HPV, you should ask to be tested for it. Maybe you don't want to know that. At first, my friend Ray and I were joking that it's like they're telling us all we're whores, because so many people we know, so many women we know have HPV, and a lot of times there's no symptoms. You don't know unless you get screened, and you need to get screened so that you can have the PAP checking for it, and they can find the precancerous cells. They can keep an eye on you, because it's super important. Direct link between HPV and cervical cancer. So do this for yourself. Do this for the people that you love. Do it for me. You can write me and tell me you went and got your PAP. I would love to hear about it. Tell me about the cold duck lip things. Tell me about the stirrups. Tell me about the paper gown. Let's commiserate. I have to go there a lot, and I have to wear that lovely outfit. So I know what you're talking about, and I know how sucky it is, but you can basically prolong your life if you get preventative care. So please do that. Today, when I was in my very long staff meeting, we had representatives from our healthcare and also from AFLAC. And last year at this time, I signed up for AFLAC for the first time because I thought, hey, I'm probably going to try and have a baby in the next year or so, and well, I should get the short-term disability because you don't get very long maternity leave, and this would buy me maybe another month or so. So I did that, and I've been paying into it. You have to have it for 10 months before you can actually have a baby and have it covered. So I did that. And today I was like, oh, maybe I should have the hospital plan, and maybe I would have last year done the cancer plan, but who the hell sits there and goes, I might have cancer. Maybe I'll get cancer. I should pay for the cancer thing. Maybe you're that person. You're much smarter than me. I did not want to think about having cancer, and I did not sign up for that one. So now I cannot, because I've had cancer, and hey, you can't have the cancer plan if you've had cancer. Also, the hospital one will not let me sign up because I will have had to been cancer-free for 5 years. Okay, whatever. It's like $500 for surgery. I mean, $700. I could use $500. The last 2 surgeries that I've had have probably cost me over $1,500 each with all the lab fees and doctor fees and anesthesiologist. So I think my thing just closed out on me, but here we are, and I'm telling you, go get a PAP. Save your life. People love you, and they want you around. And I've never been more aware of that than the last few months of all you guys kicking my ass and supporting me, and I appreciate it so much. And please talk to someone about their PAPs. I know it's totally awkward and weird, but do you go to the doctor? Because you should. Do it. Thanks.